Okay, I think we're live. Hi, everybody. I'm Audra Moran. I'm the president and CEO at Ovarian Cancer Research Alliance. And today we are having an OCRA town hall to talk about updates on our merger with the Clearity Foundation. We're really excited to be here. I'm here with Sarah DeFeo, our Chief Program Officer, Tracy Moore, our Vice President of Patient Support Services, and John Zeidman, our Chief Development Officer. And we have a few other people off camera right now that we can pull up in case there's questions about advocacy or other things that we do. So we do have some other people on deck. But first of all, just wanted to welcome you all here and say how glad we are that you came. And we're 8 months in. I can't believe it's almost September. It's almost Ovarian Cancer Awareness Month, Gynecologic Cancer Awareness Month. We'll be kicking that off next week. But that is the time last year that we announced that we would be joining with the Clearity Foundation. So it's a really exciting anniversary coming up for us. So we just wanted to talk a little bit. I'm going to give a little bit of background, just kind of how we got here. And then I'm going to turn it over to the team to tell you kind of where we are now and where we're going. So, we've long had shared goals with the Clearity Foundation and been very friendly with them. I've known Hillary Theakston for many, many years, wonderful and very competent CEO, executive director at Clearity. And she and I actually met years ago when we were in New Orleans at a Society for Gynecologic Oncology meeting, and we were talking about the Steps Through OC program that they were launching at that time. And concurrent with that, we were actually just hiring Tracy, who has joined us and has built out our entire patient support program. So it was good timing in the sense that we were both doing similar things. And we were really able to talk about our philosophy on patient support and how we wanted to morph it and change it and all of our goals. And so I think we got off to a good start because through the years, we have definitely referred patients to Tracy's nodding and she'll tell you a little bit more about that, but we have definitely referred to the STEPS program and also for other things. So even prior to that, we were familiar with Clearity for many, many reasons, but primarily we obviously were very interested in their focus on personalized medicine based on tumor characteristics. That was such a defining niche that no one else was doing. And we were very inspired to see that because, we were at that time, we were just a medical research grant making charity. We were just making research grants. We weren't doing public education. We weren't doing patient support. So for us, that was really interesting. And it was good to know that there was another group out there that was doing all the good work. So we've long admired Clearity, and so when the opportunity came along for us to think about merging, we jumped at it. We jumped at the time, we wanted to have a conversation. And we thought, let's see if this will work out. So it was really early 2024, I think, when we started talking. And OCRA at that time had been planning to build out its patient support program. We had grown from 2018, which is, I think, when our first conversations all took place together. We had grown so much since then, especially during the pandemic. I think people were looking for connection. They were looking for, obviously Zoom has provided a way for more people to get together. And I think that really helped a lot. But anyway, since then, we have just grown like gangbusters, and Tracy will tell you more about that. And I know on the Clearity side as well. So, we were very excited to start talking about how could we do this? How could we build out something that would, maintain Clarity's mission and ideals, maintain OCRA's mission and ideals. And we quickly saw that we were, very simpatico. We had a lot of similarities. The differences that we had were complementary. And so that's what I think you'll hear more about today is how we've integrated all the programs together to really create a much more cohesive ecosystem, really, for our patient support. So we're excited to tell you about that. But we basically spent 2024, really hammering out the details. We wanted to do it right. We wanted to really understand what we'd be taking on. And so we did do that. We worked very closely with Hillary and later her team, and it was a great process. I think we got to a really good space. And so in September of last year, as I said, we made the announcement. And so it's going to be our 1-year anniversary of when we announced. And then we just had transition. And that was like a, mad dash for the finish line. And so from about, October through the end of the year, we worked together with the Clearity team and with some of their vendors and did all the things that needed to get us here. So we did. And on January 1, we became one organization. And that's really where we started. And it's been 8 months. And so there's so much to talk about. I want you to hear them again from the team, but I do also want to give a shout out to Dr. Laura Schauber, who is Clarity's founder and now has become an OCRA board member. So she joined the OCRA board back in March. and has had 2 board meetings now under her belt. And will actually be coming to the September board meeting to do a little presentation on the Clearity Foundation and their mission, and just, the shared ideals that we have, and all of that. So we're excited to hear from her there, and really glad that she's with us. So that's been working out so well. And I think now I'm supposed to turn it over to Sarah. So Sarah, I'm going to turn it over to you, our Chief Program Officer, to give us kind of an overview and tell us a little bit more.
Great. Thanks, Audra. Hi,
Mhm.
everyone. Great to be here. Very happy to be with you all. And yeah, I'll tell you a little bit about OCRA programs. And I have to say, it's just been terrific to have Clarity's programs become part of OCRA. And as Audra said, we felt from the beginning that Clarity's scientific education and supporter programs are just such a great complement to what we have always been doing here at OCRA. So we have a comprehensive set of programs, and we won't tell you about them in all of them in great detail, but we'll touch on some highlights here today. In general, our programs fall into just a few categories. We have research and data initiatives, we have advocacy and policy initiatives, and we have education and support programs as well. So our scientific research programs are very much at the heart of our mission. We have been a science-focused organization since our founding in 1994. Um, we have a very robust research grants funding program. Over the years, we've funded over 400 grants, about $138 million that we have raised and invested in research. And these include big grants to senior investigators, like 900,000 or $1 million grants, down to smaller grants for early career investigators and pilot awards, more like $100,000 awards. So really a full suite of grants that fund researchers at different stages of their career and projects of different scope. And these grants are peer reviewed and selected by a terrific group of researchers and clinicians who sit on our scientific advisory committee. So that's work that OCRA has been doing from the beginning. But of course, we've always been interested in supporting and finding new ways that we can advance science. So over the years, we've been expanding the work that we do that really focuses on convening and collaborating and shaping the future of research. Um, when we merged with the Rifkin Center earlier this year, will have the opportunity to continue their very well-regarded Ovarian Cancer Research Symposium. So we'll be continuing that. It's a scientific meeting, which is terrific, and we're planning to hold it probably in Philadelphia in 2026. So we're excited about that. But our most exciting and ambitious project yet is something we're calling the Community Accelerated Research Exchange and our patient registry, which we're launching this year. And I won't give you a ton of details, but this initiative brings together patients, researchers, and private sector to really collaborate and share data, all with the goal of accelerating research. And there are lots of different elements to this. And an important piece of this will be a brand new AI-driven clinical trials navigator, which Tracy will talk about a little bit more. We've always had a clinical trial navigator, and I know in Clarity had an outstanding clinical trial navigation program as well. So we're excited just to continue that work with the sort of new and improved version that we're all working on together. So in terms of our advocacy and policy programs, we are the only organization dedicated to advocating for all ovarian and GYN cancers on Capitol Hill. We really focus on improving research and education, drug and diagnostic safety, and always working on access to care for all members of the community. And we do this, regardless of who's in the White House and regardless of who's in Congress. We have an incredible team who has spent years developing relationships all over Capitol Hill. And so we and our advocates are there working for the needs of the community year after year. To date, part of what we do is work on federal appropriations for research funding, and to date, we've helped secure nearly $4 billion in federal funding, which is very exciting. Obviously, federal funding for research is absolutely essential. We have an incredible advocate leaders program where we've trained over 1,800 survivors over the years to advocate on Capitol Hill and in their local communities. And these advocates have held thousands of meetings with members of Congress, and we bring them together every year in person. We'll be doing it again in March for a terrific training and teal takeover on the Hill, which is always an incredibly fun and inspiring day. Something that we all look forward to every year. And Chad Ramsey, who's our VP of Policy, he's not on camera right now, but he is here. So if any of you have any specific questions about our work on the Hill, just pop it into the chat, and we can get a little bit more into details on that.
Sarah, I realized I had a housekeeping item that I should have mentioned, but if people
Sure.
have comments or questions, you can just pop them into the chat and we will be
Yes.
being fed those. So just FYI, I meant to say that earlier. I'm sorry.
No, no problem. Yeah, we'll take them at the end. And so I want to pass it to Tracy, who will talk more about our support and education initiatives. In general, this is an area of programmatic work that has been growing rapidly over the past several years, really thanks to Tracy. But this is an area where Clarity's programs have been a great complement to OCRA's work, and our goal has always been to evolve them so that we were able to expand them, so that more people could get the information and help that they need, which is something that we know is a priority of Clarity's, and of course is always a priority of OCRA's as well. So Tracy, our Vice President of Support and Education, is here, and she leads an incredible team of educators and oncology social workers who do this work. So Tracy, passing the mic to you.
Thanks, Sarah. Hi, everyone. It's good to have you here. I'm just going to provide a quick overview about all of our programming, and I think it's probably easiest to explain it in 3 different pillars, if that's okay. OCRA has, like when we think about our support and education programs, we have access to care, support, and education. So, and like the Clarity Foundation, OCRA is committed to providing all of our programming for free. So, access to care, when we think about access to care, we have a free genetic testing program. And just to give you an idea, I think we've had like over almost 4,500 kits claimed and have found 214 positive mutations. So that's, we're feeling really proud about that program. We have a Find a Doctor tool, so anyone can easily find a board certified gyn-onc or med-onc or surgical onc in their local area, making sure that people really can get the best care possible. And as Sarah has mentioned, we have a clinical trial navigator that I'll tell you more about some exciting things around that. But there are people looking for clinical trial navigation have 3 choices. You can do a web search yourself, or we have an easy matching tool, and we've got the one-on-one personalized navigation as well. So just to give you a sense of the volume, I think this year alone we've had 933 surveys that match tool completed, and those numbers are just, they keep growing. And I think some of that is around the education that we're providing, and I'll get to that next. In terms of support programming, OCRA's first support program was Woman to Woman. It's a peer mentor program that's available internationally, but we have 19 sites across this country and a large national team. I think we've got almost 700 mentors nationwide that are active. 117 of them are on the national team. And we're making matches every single day. The last time we counted was 2 months ago, and it was over 2,600 active matches. So and people can be matched whether they're a patient, a survivor, or a loved one. And I think that's really an important piece, and to be sure that anyone who's looking for that kind of care can get it. Our patient support line, Audra and Sarah both mentioned the numbers are growing tremendously in all of our programming. As of today, when I looked at the numbers, we have almost hit We're almost at the same number we had total for last year today. So we're at almost 2,500 calls. And when we talk about calls, that can be anything from information to understanding clinical trials and resource navigation. Staying Connected is our support series that's online. We've got 6 weekly groups, ranging from a group that's offered in Spanish, living well after recurrence, new diagnosis. We have a program specific for loved ones, one specific for patients with endometrial cancer. And then we also have monthly sessions in Express Yourself, which is a creative arts program, book club, our roundtables, and we run our bereavement series twice a year. So lots going on in that arena. And I think we serve about just under 4,000 people, 4,000 attendees to these programs. The program you're most familiar with and that I was really proud to refer patients to for a very long time, and now for it to be part of OCRA offerings is really powerful, is the STEPS counseling. This is really unique and wonderful programming that has expanded now to serve all gynecologic cancer. We're really thrilled. We've partnered with the STEPS counselors and IRIS counselors. IRIS is an oncology social work programming. So we've providing counseling since the program relaunched in April to 65 people, which is really, we're really thrilled at how quickly it's starting to expand. I think just for perspective, when the merger happened in January, there were 42 active participants in the program. So just in the 4 months, we've got 65 people nationwide. And I anticipate that's probably going to double this year. And next year will be well over 200 people that we're serving. So we're really thrilled. In our education pillar, under our education pillar, we've launched workshops, and these are new to OCRA. They're based on the STEPS model of care, and this was a way we really felt we could scale the program, being sure that we'd be able to provide more and more care, giving people choices. They still can get the one-on-one counseling, but they also then have an opportunity to be part of a program and to develop community. So the workshops are run weekly for 4 weeks. And we have 3 different workshops. One is Ovarian Cancer 101, one is Endometrial Cancer 101, and one is our new Survivorship Program 101. And they're co-facilitated with an oncology social worker and a scientist. It's interactive, and it gives people an opportunity to really have a foundational education around some of the things they just wish they had asked their doctors, or maybe they heard when they were first diagnosed and now are too embarrassed to go back, but really giving people a primer. They've been really well received, and we're really thrilled. And I suspect they're going to expand to different topics and different themes, but they'll run quarterly. And but then we also recognize just how incredibly well science education was done at Clarity, and wanted to really embrace that and find a way to grow and scale. Of course, we're still providing one-on-one science education conversations with people, but we've also developed a new program called Staying Current. Staying Current meets weekly, and they're in 3 different categories. One is for new diagnosis, one is for people who have had a recurrence that are platinum sensitive, and one is platinum resistant. And this is really a much higher level science, really in-depth science around biomarkers, genetic mutations, and the phase 3 clinical trials that people might be eligible for, and some of the treatments that are in the pipeline, providing people a really good overview and the ability to go back to their teams and just say, hey, I've heard about this. Is this something good for me? So we're thrilled. And that program launched in May, and we've already had 136 people participate. So it's really, it's moving very quickly. And as I mentioned before around education, it's giving education, we're giving people choices on how they gain their information and their support. And you can get support in all different ways and education in different ways and can participate in all the programs or just one or two, just based on where you are in each time.
Tracy,
Couple more,
I'm gonna break in just
sure.
because there's a couple of questions.
Oh, I'm sorry.
No, oh, no, that's okay. That was my fault. No worries. So how do people get matched for woman to woman? Someone asked.
Oh, how do you get matched? So it's actually, you can submit an online request or call us. We will always speak to someone personally and really hear what they're asking for. Because sometimes if you fill an online form out and say, I'm newly diagnosed with ovarian cancer stage 3C, and I'd like to talk to someone who's been there, you have one idea of what someone might be looking for as an example. But when you speak to them, you might hear, I'm a young mom. I have two kids under the age of 10. I'm thinking about what I need to do about my career and my family. And now all of a sudden you're starting to see that there might be a different focus. It might be around the new diagnosis, but also around family and career. So we really make personalized matches. The mentors are trained. These are people who have been there, gone through their own diagnosis or their loved one's diagnosis. They are supported by oncology social work, so there's always an escalation if there's anything that's out of scope of being a mentor. But we do a personalized match. They've been really successful. We have people now that are international mentors, which is exciting for us. Canada, Israel, a couple other countries actually, and all gynecologic cancer. So it's really powerful. We follow up after a match happens with both the mentee and the mentor just to make sure everything went well. It was a good connection. Sometimes connections and matches will last one call, and other times a really, really long time. And I'm really proud of the connections that people talk about who they say, you found our sister, this is my new family member and we are connected for years. So, but whatever someone needs, it's really important. And sometimes people will need something different. So we've made second matches if circumstances have changed.
Okay, and now I have a question. I think it might be more for John. Um, are you okay with that, John? Can you come off mute for a second? So someone asked basically, how do you think it's been going since this long with, I guess, January? I think that's it. In terms of Clearity supporters, do you feel like you've been getting a lot of, contact with Clearity supporters? How's it been going?
I think like any transition, things often start slow. A lot of the time that it takes for people to get accustomed to the work that we're doing. Um, but we have seen activity on the side of the Clarity supporters ramp up over the summer into the end of the year as we approach the end of the year. And actually, that leads to an exciting announcement that we want to make today. Like many nonprofit organizations, a big part of our fundraising typically happens towards the end of the year in those final months. And for us, that really kicks off with September during Ovarian and Gynecologic Cancer Awareness Month. And we are really excited to announce that Laura Shaver, who Audra referenced earlier, who now sits on the OCRA board, has pledged a dollar for dollar match for all gifts made by Clarity supporters up to $100,000. So that means that really every donation that comes in between now until the match is met from the Clarity community will have twice the impact on OCRA programs than it would have typically had. And we're really grateful to Laura for her generosity, for her passion, and we hope that you all will join her in her effort to strengthen the ovarian cancer community by supporting OCRA and the work that we're doing. And we're really confident that as people get to know the work that we're doing, the programs, a lot of the things we talked about today in terms of the integration of Clarity programs into the OCRA suite of services, that they will come to appreciate the work that we're doing and make those vital gifts that are so important to supporting those programs going forward.
Absolutely. Well, thank you. That was a good answer. We do have a question about advocacy, but and I'm cognizant of the time, so I just wanted to be sure I made one forward statement and just say how excited we are, first of all, to have obviously Clarity join us, and it's really been going so well, and we only see it getting better. But Sarah did talk about the research exchange, and I think Tracy, you might have even mentioned this, but I know a big part of what Clarity was really focused on was clinical trial navigation and science and being able to help people with that. And our research exchange that we're building out has such capabilities. And one of them is to do a personal match based on people's records when they upload them for the registry. You can people don't even have to participate in the registry to be able to use this more personalized version. So we're really excited about that. We've been continuing to work kind of behind the scenes with some former Clearity staff that are now OCRA staff who are very well versed in this. So we're thrilled with that. And also, we're going to be doing personalized education journeys, which was an idea that Clearity had brought to us from the beginning and that we loved the idea of. But they're going to be coming through this research exchange, and they're going to be monthly updates. So it'll be based on research and written for lay public, written for researchers, written in all different formats, and people can sign up for the information that they want and get it delivered at the rate that they'd like. And it's just a highly personalized way of doing things. So we're really excited to be able to continue that legacy as well for Clearity. Chad, I know you're here and we only have a few seconds, but few minutes. But would you mind somebody asked, what sort of advocacy does OCRA do in DC, like on behalf of patients?
Sure, yeah, absolutely. Sarah mentioned our work on appropriations, but we also look to make sure that every aspect of the patient experience is represented on Capitol Hill. And so we will bring patients with us onto the Hill. We usually do an annual in-person advocacy day. Some former Clarity staff were able to join us this year in March for our advocacy day. And we advocate on behalf of different types of legislation. One type of bill that we do is to ensure that patient protections are included in food and drug approvals, making sure that the most current diagnostics are available to patients. We've been working on access barriers to genetic testing and other biomarker testing. There's a whole gamut of issues that we work on. We'll be launching legislation to expand the federal commitment to gynecologic cancer later this year. On a sort of a tentpole piece of legislation that we're really excited about. And most recently, we've been working really hard to try to maintain the CDC's programs that promote cancer prevention, including Johanna's Law, which is the Gynecologic Cancer Education and Awareness Act, and the Ovarian Cancer Control Initiative. The president's budget recommended eliminating these programs. So we were on a red flag alert with all of our advocates pushing to make sure that they're included in the FY26 budget. And we got good news out of the Senate a couple of weeks ago that they included full funding for those programs. And so now we're waiting on the House. In fact, we've got advocates going to district offices, dropping off some materials that we created about these programs to make sure that House members know about how important these are. So it's a big program. We have 160 advocate leaders now from 40 something states, and we want to just continue to grow and do the best we can to represent the community.
Yeah, great. Well, thank you, Chad. That was very good in 2 minutes. Sarah, did you mention the conference dates by any chance? I think we should probably just throw that out there. I can't remember if you did. September.
I don't know if I did, but maybe Tracy did. September 15th, 15th through 17th. Tracy's
Okay.
nodding, which means I got
Sorry.
the dates correct. Yeah, and we're absolutely thrilled. So this conference has been going on for more than 2 decades now. And Tracy and her team put together an incredible agenda. They always do every year. It's 3 days of education and community. We've got like 50 sessions or something. I think Tracy said the statistics were quite something, but we have an incredible number of people registered this year. I think we're at like 1,500 people already registered for the conference, which is incredible. Given that this is a relatively small community, but people coming from, I think, almost every state and like 40 something countries. It's really quite extraordinary and really exciting to see the level of engagement that we have. So yes, I encourage you to, registration is open. registration is free. And we have all kinds of great sessions, some recorded that you can come back to, plenty of live sessions and interactive sessions with Q&As. So I really recommend that you sign up and take a look. It's going to be a terrific event, and we do it every year.
And these numbers are so big for us this year. I mean, it's the first
bigger
time
than
we've offered
usual.
it for free, but we do believe, obviously, the Clearity community and the Ripken community have really come together and I think are adding to all of that. So we're really excited to see everybody together there in just a couple of weeks, actually.
Yep.
So thank you to all of the panelists today and for supporting this today. And I'm glad that all of the people out there have come and asked questions, which was nice. But I wanted to just let you know we're always here. So if there's questions beyond today, you can always reach out to us. We love to talk about what we do. We love to talk about the integration. And we only see this getting bigger and bigger and better. So more to come, but thank you for coming today. And again, don't forget, just reach out anytime. We're always here. All right. Hope everybody has a good day.
Thanks, everyone.
Thank you.